This ESMO meeting will be of interest for GI cancer specialists because at the session of GI cancer, upper GI cancer, we presented really relevant studies. For instance, FLOT trial, the definitive result of FLOT trials, opening new rooms for the treatment of resectable gastric cancer, and Jacob trials for the treatment of advanced gastric cancer with a combination of pertuzumab and trastuzumab.
The FLOT-4 study was a phase 2-3 study aiming at improving overall survival in patients with resectable adenocarcinoma of the stomach or gastroesophageal junction. We randomized 716 patients to receive either perioperative FLOT or perioperative ECF or ECX, which is has been the standard of care at that time when the study started. Patients received chemotherapy pre-op, they were operated, and then post-operatively. And the key results were that FLOT improved overall survival in median from 35 months with ECF to 50 months with FLOT. It also improved progression-free survival from 18 months to 30 months and improved resectional rates and R0 margin-free resectional rates.
The FLOT trial is really a relevant trial because for the first time it was demonstrated that a triplet based on a combination with a taxane is able to give an advantage versus another triplet combination based on anthracycline. And this confirms that preoperative chemotherapy may play a crucial role in the benefiting for patients with potentially resectable gastric cancer.
The Jacob study was designed to evaluate whether the addition to pertuzumab to conventional treatment of chemotherapy plus trastuzumab in the population of patients with metastatic gastric cancer or gastroesophageal junction cancer that were positive for HER2 had an impact in overall survival. And this was done according to the data that we had for breast cancer. So basically, we randomized a total of 770 patients in first line, HER2 positive, to receive either conventional chemotherapy treatment with trastuzumab and pertuzumab, or conventional chemotherapy treatment with trastuzumab and placebo. We aim to observe an impact in overall survival. And although the study was very well conducted, we didn't find a statistical significant advantage according to the statistical considerations for overall survival, although there was a clear trend that some patients could benefit in all the parameters that we evaluated, not only overall survival, but progression-free survival and response rate. Nevertheless, so far, we have failed to find any subgroup of patients that could benefit more from the treatment, but we are still actively evaluating other biomarkers and clinical factors that could predict any potential population that could benefit.
Although Jacob trial is maybe considered a negative trial because it didn't meet the primary endpoint of the overall survival, we have to keep in mind that the advantage for the combination in comparison with the trastuzumab alone was 3.3 months. This is an impressive advantage in survival for other trials, but in this case, unfortunately, it was not statistically significant. But there is some suggestion for these negative results that further analysis may confirm, and that probably not for all the patients, but for a subset of the patient, this combination may be really helpful. Obviously, biological analysis and clinical analysis will be confirmed or not this assumption.